Welcome to Coast Guard How To. In this video, we are going to discuss techniques for taking control of test anxiety by defining what test anxiety is, covering a few facts about test anxiety, what to do before a test, how to perform during the test, and what to do after the test is over. What is test anxiety? According to encyclopedia.com, test anxiety is a condition characterized by persistent anxiety in test situations that is severe enough to interfere with performance. Some physical symptoms include rapid heartbeat, dry mouth, sweating, stomach ache, dizziness. Let's go over a few facts about test anxiety. Test anxiety is a learned behavior. In some cases, the association of grades and personal worth causes test anxiety. In others, test anxiety can come from a feeling of lack of control. There are situations where test anxiety can be caused by timed tests and the fear of not finishing the test, even if one can do all the problems. What to do before the test? First, put things in perspective. One test doesn't determine your talents and abilities as a successful student. Most importantly, be well prepared for the test to increase your confidence. Ask your instructor for practice tests or additional homework problems, and participate in tutoring sessions. Avoid cramming, as it is a culprit of test anxiety. Also, remind yourself of past successes. Think of a challenging course in which you struggled but eventually succeeded. However, don't overlook physical preparation. The night before the exam, organize everything you will need. Get a good night's sleep 2 nights prior to the exam. Watch caffeine, alcohol, and sugar intake. Take a 5 to 10 minute walk as a study break. Eat protein and drink water. Lastly, arrive prepared and positive. Don't come too early or too late. Avoid talking to other students. Refrain from flipping through your notes or books. Instead, relax. How to perform during the test. First, put into practice helpful test-taking strategies, such as read the directions slowly, circle significant words, jot down notes in the margins if you are allowed. When anxiety begins, engage in thought-stopping techniques. If you find that you are getting nervous, comparing yourself to your peers, or thinking about your ultimate test score, start by using calming techniques throughout the exam. If you get overwhelmed, turn your paper over and take some deep breaths. Or stretch your arms and legs in your seats to release muscle tension. Also, approach your studying seriously, but think of the test as a game. Your goal is to collect as many points as you can in the time available. You are in control of the test, and the test is not in control of you. Expect a few curveballs on the exams. When faced with unexpected questions, just relax. Don't dwell on a question too long. Simply skip it for now and return to it later. And finally, take one step at a time. Break your test into small, manageable parts. Focus on the questions you find the easiest to answer first. Things to do after the test. Reward yourself. Yes, that's right. Take a night off with a good movie or dinner out with friends, regardless of how well you think you did. At this point, you can't change your test performance, so you need to move forward, not punish yourself, and engage in positive activities. Second, communicate with your instructor. Let him or her know that you experience test anxiety. Perhaps you will get more suggestions. Conversations with your instructor also allow him or her to know your desire and intent to do well in the course. Also, decide if you need additional academic skills. Think about whether or not you need additional study strategies, memory techniques, or time management tips. Your test anxiety could stem from lack of information in these preparatory areas. Finally, select and try 1 or 2 new techniques for each test. Keep track of what helps lower your anxiety and implement these into habits for future tests. Throw out what doesn't work for you. This completes the video on test anxiety. Be aware that test anxiety is manageable through diligent test preparation and through the use of effective calming techniques.